Good morning, Wakefield, and welcome to our what has turned into a bi-weekly COVID update. Last week we had our final clinic where we completed close to 400 second shots, which was very satisfying. And I think probably we distributed a little over 3,300 vaccines in Wakefield. So great job by our crew, especially Tom Walsh and Ruth Clay and Laura Gorville and the volunteers and the Board of Health and everything. Really was very warming. But anyway, that's the good news. I think the not so good news is that we are seeing a bit of an uptick, not only here in Wakefield, but statewide. And maybe, Ryan, if we can show the map of the state that we're all used to seeing by now. May notice that last week we had, and that circle is Wakefield, so Wakefield is still in a caution area, but our trends aren't that good, and we'll talk about that in a second. But statewide, there are 32 communities now that are of high risk, and you can see a big concentration down the Cape and really sprinkled around. Take that from last week, where there were, around 20. So this is a big uptick, probably a 50% uptick in communities. So that is something to be concerned about. And I'm sure that Tom and Ruth and others will opine on this. But my personal feeling is that people are not, you can take that down for a second, Ryan. People are not, people are fatigued. The economy's opening up. And I get that. I'm as fatigued as anybody else is, but people are not using this. They're not socially distancing. They're not helping themselves. And I think there's an apathy that's developed in some that are saying, thank God that my parents, my grandparents, they are vaccinated. They're in an older, vulnerable population. I don't need to worry anymore because now I can go do whatever I want and still visit them and be comfortable. That's not the case, people. That's not the case. We cannot let down right now. And the numbers are showing that in Wakefield too. Can we show that chart, please, Ryan? Okay, so this chart shows Wakefield, where we are. If you go to the right, cursor to the right, total test positive the last 14 days. Keep going. 155. Okay, positivity rate of 4.31%. We were down in the twos and the threes not long ago. And what is really interesting to me is when I look at these numbers statewide, and Ruth will talk about our numbers, is that, and kind of going back to what I mentioned before, that statewide, the last 2 weeks, there were 21,000 positive tests. So those numbers are going up. We're seeing them in the news every night. And of that, 45% of those people, 45% were under 30, okay? Combination of people going out, people getting fatigue, and I think the good news, the kernel of good news I try to find on that is that those who have been vaccinated, those over 60 for the most part, only 12% of that number is made up by them. So the people that are vaccinated, it really does work. And I'm thrilled that it works, and that is absolutely fabulous. But the rest of us have to be tough and hang in there for a little bit longer. I mean, I get it, I understand it, but I'm also not seeing as much of this as I did. And I was really proud a few weeks ago when I saw a lot of this people going around. But last few days, I see people going around the lake and outside and walking around. And I'd say it's probably less than 50% are really sporting this. So please, Wakefield, let's not blow this at the finish line because we are almost there. Ruth, words of wisdom. I was kind of gloom enough. You always said you're gloom, so I was a little gloomy for you.
Thank you, Steve. I don't really have a lot to add because you've already gone over the numbers and the trends. So we are continuing to doing contact tracing where we can pretty much do the numbers right now in-house without sending them to the Community Tracing Collaborative, because we do have over more than 2 full-time people, probably close to 3 FTEs at this point, just doing case management and contact tracing. We do get some complaints, but we are actually starting to get back to doing some of our other work, and our regular complaints are definitely ticking up at this point. So
Can you
holding
talk
course.
a little bit about what you've seen in clusters, if any, what you've been seeing with the contact tracing?
Sure. Well, we just had a presentation actually from the State Health Department that was looking at the sports clusters. And as will come as no surprise to anybody, 50% of the clusters and cases of sports clusters have been ice hockey.
Hmm.
And everything else together adds up the other 50% indoor ice hockey, which is mostly done, but there's still the younger kids still are playing indoor ice hockey. So that comes as no surprise. Our cases really are, as you said, younger adults who are out in restaurants and socializing, in homes and parties, and our students who are positive are not getting it from each other or from school. They are getting it from their parents.
Yeah, so you're going
And
to see a
that's,
cluster of like this family, 4 in this family, and then 5 over here, and then, so that's,
and interestingly though, when it's in one person in the family, the entire family turns positive.
which I guess makes sense.
Yeah. So that is basically what we're seeing.
Okay, great. Well, thank you for all your hard work on this. Tom Walsh, need to unmute. There you go. Tom's on vacation because we're not running a clinic this week because we can't. So
No, actually, you guys touch on everything. My only thing is that there is definitely there's a direct correlation between the spikes that we have and holidays. St. Patrick's Day was the 17th. And guess what? All the numbers started rising. People just have to be smart. I know everybody wants to get it over with, but we got Easter coming up in 9 days. There's going to be another spike. We just tell people, just go by the CDC guidelines. 10 people in your house when you're having these things. And if you've been vaccinated, great. If you haven't, you got to wear a mask. Socially distance. If you do those things, you're going to get by this thing. Probably in 2 months, we'll be so much better off because most of the people will hopefully have at least one shot in them. So just be patient. That's all I got to say.
yeah, I frankly think the best thing for Easter is a cookout outside. I think the long range is going to be around 60 degrees. We're hardy New Englanders. Stay outside. Keep that number low there. We are joined today by Vice Chair Julie Smith Galvin, who is on site. It's like a reporter for Channel 5. She's on site at Jocelyn Center. So thank you for joining us, Julie, and any words of wisdom.
I don't think so. Obviously, I'm wearing double masks here at the Jocelyn Center. I think just to reiterate everything that's already been said, with Passover and Easter coming up, we have to stay vigilant. We're all tired. We know we're all tired. The spring is coming. Try to do outdoor things. And just thank you again to the entire team, to Ruth and Tom and Steve and Jen, who's doing all the communications, and the Board of Health, of course. So thanks for having me, and keep being vigilant.
Thank you, Julie. Laurel, our health nurse extraordinaire, who's on mute.
I know, sorry, I lost my button. Good morning. I am so concerned about this uptick of cases. And the other thing I'm concerned about is, the governor has allowed, a progression in reopening. So certainly we would see this. And I don't know if anyone gets the Globe, but today they featured a family that had been so careful for this whole year and then lost a father-in-law and the son-in-law within days of each other. And they're just, they were trying so hard. They have no idea, they were not, they thought that they were following guidelines. So it's a real somber reminder. I would say that I am hearing that there's lots of people with travel vacation plans come April. And though the traveling testing requirements have changed, I would ask people to voluntarily be very aggressive about testing, and the testing sites are still open. I am hearing that the wait lines have really been reduced. It's certainly easy. It's just, it's good to know, so that you can kind of stop in your tracks. So just please, as Steve keeps saying, let's not blow up before the finish line. These are lives we're talking about. I do thank the people who have been pretty cordial with our contact tracing, and people for the most part have been very thankful for the advice that our contact folks have given them, because we kind of go over nuts and bolts of what you need to do in order to isolate and take care of yourself. But this is pretty startling. I just looked over the ICU and intubated statistics and the average age of death. And so 69 seems to be the average. I'm just a decade from there. That's, I have plenty of young appearing friends who, who are fit, who may be succumbing, so that is our age category. We're not talking about anything else. And it's, the more we know, the more concerning we have, but we are really facing this double-edged place in our heads. It's really hard. We have one foot in opening up and being vaccinated and getting back to normal, but we still have a lot of victims, falling from this, both in death and long haul COVID complications. So for them, as Steve was talking about outdoor masking, I myself wear glasses and I fog up a lot. And if I'm 5 yards from people, I start getting my mask back on and I take it down when I know that I'm a safe distance so that I don't hit a tree while I'm walking. But at the same time, I think it's really, it's just a show of solidarity and concern, because you just don't know who is vaccinated and who isn't. And it just also is kind of a visual reminder that we're still in this together. So good luck. Do have healthy holidays, please. And we'll see you in 2 weeks.
Thank you. Thank you, Laurel. Jen is going to be pinch hitting for the schools today.
Yes,
Jen,
Superintendent Lyons couldn't be here this morning, but he did forward the school information, which is also on our dashboard on wakefield.ma.us. In the last week, there were 13 student cases and 1 staff case. And in terms of quarantining, there are 59 students, and kind of the peak areas are the high school at 16, the Galvin at 16, and the Doyle at 11. And there are 5 staff cases. And again, those are on our dashboard. And I also did want to just highlight another addition to the dashboard. The Mass Department of Public Health has released a municipality vaccination report, and I'll put the link in the chat. So if you're someone who really likes to crunch data, it is just an Excel spreadsheet. It's not super beautiful to look at, but it breaks out municipalities, including Wakefield, by demographics for vaccination. So you can see the breakout by age, and it's quite interesting if you enjoy number crunching. I'll put that in the chat right now for you.
thank you. I think another thing that I'm hearing that's some of the colleges are seeing spikes, and they're sending their students home. So I think a couple around us, Merrimack and St. Anselm, I guess, is sending the kids home for Easter break. A lot of them may be, positively affected from up there. So that's another thing we're going to have to be very wary of and look at. And I think, that Tom and Laurel and Ruth make a great point. It's after the holidays, we always see a spike, and hopefully that Passover and Easter won't be the same. So let's look at, we'll have to take a look at that as well and be safe. Anything else to add, anybody? No? Okay. Let's be safe, Wakefield. Let's be smart. Really, just, keep your groups small, try to stay outside. The warm weather's coming, wear your mask, all those things that we've done for a year now, right? We've done it for a year, as my old coach, John DeCommandria, used to say on cross country, finish strong. Got to finish strong, Mayo, he'd tell me. So come on, Wakefield, let's finish strong. We're charging up the hill, and it's there. So thank you, everybody. Stay safe, and we will be back in 2 weeks. And hopefully not before, unless something happens. So take care. Have a great day. Bye.
Thank you.